morning.
Ma'am, I think we'll begin the session, ma'am.
Good morning, sir. Good morning, ma'am.
Yeah, good morning to all. We will welcome, on behalf of the Department of Psychology, American College, on behalf of the participant over here, I welcome Professor Dr. Olesya Volkova. I think I pronounced correctly, ma'am. So for this wonderful webinar series on promoting mental health and well-being, thank you for accepting our invitation and being with us here to share your knowledge and experience on learned helplessness. I welcome you from India. Please share your experience.
So thank you so much for suggesting me, for inviting me to participate in very important distant event. And I see that your activity is very popular among people who live in India. And I hope that my knowledge and my expertise will be useful and helpful. And I prepared a very short presentation for you, colleagues. And I hope that you will have questions and you will have interest to the topic of the learned helplessness phenomena and state. And I will try to explain in a very simple way what do I mean and all the world psychologists mean under the learned helplessness state, and why it is important to have some information about this state and why it is important for psychologists in our professional activity. So now I will open my short presentation. So can you see the slides? Yes.
Yes, ma'am. Yes, ma'am, we can see it.
Okay, so I have only 6 slides for you because I'm not going to overload you with very difficult information. On the first slide, you can see the email. This is one of emails which I use for international collaboration and international connections. You can also find me on Facebook. I have the same nickname which you can see on the slide. And if you will have any questions, you can answer me anytime, and I will try to give you support, my professional support. I am not very good professional in all spheres of psychology, but I know some of clinical psychology, some of psychotherapy, non-medical, non-drug therapy, and you can ask me any question. I will be sincere to you and give you any information I can give. So learned helplessness is a very often met state now in situation, especially in situation with of pandemic, COVID-19. And now I can see that a lot of people who were quite stable in their psychological state, and they were brave and strong and could support themselves. Now they lost their power to defend this
voice, please?
Stressful situation.
Madam, could you please increase the voice?
Please check your mic. I think madam's voice is clear. I think please increase your volume in your gadgets. Okay, if you are using mobile, increase your volume or else.
Not audible, sir.
You are able to
You have to check
very clear.
your gadget. Please check your gadget and increase your volume.
Ma'am, you can go ahead. Please proceed.
So can I continue?
Yes, please, ma'am, you can continue.
Okay. So and I decided to give you some information about what do I mean under learned helplessness, because sometimes people are really helpless. They objectively helpless For example, when they are ill or they have difficulties in their psychological development, and they obviously and really cannot do something in their life. But sometimes people are taught to be helpless, and this is the result of their family parental relations, and people think that they can't do something. For example, they are not very smart, clever, and they are not very good. They cannot try any activity, so they think that they are helpless. So I have a slide which gives some information about the situation with learned helplessness state, which we can see now. And you can read that more and more representatives, especially of modern youth, can be characterized by low level of motivation. Some young people do not want to learn, they do not want to study, they do not want to develop themselves because they think that they have no direction in their life. They suffer from lack of interest in their life, and they feel that their cognitive sphere is weak, and they are not very active in their life. They don't have active position in their life. So, and they are not involved in life as a process. So they wish to obtain result, sometimes material result. So they want to have a good material world, but they don't want to be developed as a personality. And now, so about learned helplessness. So this is the state. There are two different terms for helplessness: learned helplessness and personal helplessness. When we are speaking about learned helplessness, it is a state. Sometimes it is a short time state, and we can mention it. So it is a result of repeatedly repeating influence, which avoiding is impossible. Sometimes learned helplessness is the result of stress, regular stress. For example, when people are suffering from long and they cannot overcome it. Also, it is a result of failures. So I don't have positive results in my life. I try to do something, but I am not lucky. So nothing good happens in my life. I try, but the results of my activity is a failure. I feel fiasco. So the low self-assessment. So when people think that they are not effective, they're not very good, it can be the base for feeling them as a helpless. So low level of self-claims. So if I have experience of failures, I am not very effective, my expertise is weak, so I don't put any aims or high objectives, and I don't think that I will be lucky in these activities. So also behavior violations can be a reason for feeling helplessness. So I told that people who are characterized with learned helplessness demonstrate weakened motivation. I don't want to do anything because I cannot. So I won't even have any plans for it. So they can demonstrate a violation of cognitive activity. So they think that they are stupid enough to make decisions, to be active. And also to feel helpless. Before feeling helpless, people need psychosomatic frustration. So there is a very strong connection between somatic health of our body, and learned helplessness. When I am often ill, I can't put strong and high aims. I am restricted in my communication. I have no many friends, and I feel weak and helpless. So, as I started to speak about somatic status, it is very connected with, tightly connected with somatic status of a child. You know, as psychologists, that childhood is one of the most important periods in human development. And if a child is often ill, so he is restricted in his communication, in his development, in his education. So he is out of the border of real life relations, and he becomes feeling that he is helpless. So that any even simple aims and objectives are not achievable for him. So also somatic disease is a crisis situation for the child and his family. When parents know and feel that their child is ill, so his somatic health is weakened, parents become too caring concerning to their child. They restrict his activity. So usually parents tell their child that, don't care, I will do anything for you. So take care of yourself. So don't go there, don't do that. And so a child stays without any environment which will help him to develop, to try his efforts, to make mistakes, to correct mistakes. So a child teacher is taught to be helpless. So the somatic disease influences on development of the child and parent relations. When I was writing my dissertation, I met some parents who took very active position and very strong position opposite somatic diseases of their children. And they told, I know that my child is ill, he or she has a disease, but we should fight it, and it's just a temporary situation. We will overcome it. And such parental attitude helped children to overcome somatic disease and to become strong, to be well developed, to be well educated. And such children didn't become helpless. So they decided that disease is a temporary situation. They should overcome it, and that is the main task. But some parents decided that disease is something which should stop the development of their children. And it is very difficult to separate such children from their parents. Such children always stay children even when they are in their 20s, for example. The child in the situation of disease is dependent on the help of the adult substantially. So when people receive help, they receive support. They never decide and solve their problem alone. They are taught to be helpless. So the lack of freedom, the lack of difficulties lead to the helpless attitude to life. And life has restrictive character. When people meet somatic health, somatic disease, so they are restricted. They are restricted in their communication, in their education, but somatic health and somatic violence is not the reason to become helpless. It is just the reason to find efforts and resources to overcome the disease. So on this slide, you can see the features which can help to identify if the person helpless or not. So I told that there are 4 compounds which can give a sign of a learned helplessness. It is a weakened motivation. So when a person doesn't want to take active position in his or her life. It is emotional sphere or violations of emotional sphere. It's anxiety, it's aggression. So usually it is a depressive mood, and all the difficulties with emotional sphere can lead and can be a sign of learned helplessness. When a person becomes a teenager, you know that one of the most important personal spheres to be developed is willpower. And when a teenager has weakened willpower, he cannot overcome difficulties. It can be the sign of learned helplessness development. And after that, when a person has emotional, motivational, and willpower difficulties, it influences his cognitive sphere. Because when we have no experience of overcoming difficulties, we do not have enough cognitive strategies to make plans to survive, to jump over the difficulties, to fight the difficulties. People feel weak. They don't have any variations how to change their life route, how to change their life position to overcome difficulties and to be the winner, to be strong, to be self-developed, to be self-determined. And there are some factors which influence the development of learned helplessness state. Now I'm speaking about helplessness state, not objective but subjective, because truly all these learned helplessness people can be motivated. They can rule their emotions. They can be highly willpowered, and they are not stupid or not, they have no deficits in intellectual sphere. This is only their attitude to themselves, to their life activity. What can influence it? First of all, it is a child-parental relations. When parents want their child stay a child till his mid-age, they can do that. They just don't let their children be separated from family. When parents don't believe that his child is strong and wise enough to live his own life, to make his own mistakes, they can organize the life of his children in the learned helplessness way. I told a lot about somatic health, but I can say that not somatic disease influences learned helplessness development, but the way family form the attitude to the fact of somatic health. This can lead to learned helplessness. Sometimes parents say that, okay, so you feel sick. For example, you have a flu, but you should take your pill. You should go and make some physical exercises to support your health. You should make some preventive measures not to become ill. So you should do something, not just to stay in bed and we will care about you. So giving the responsibility for the help to the child himself is a very good way to fight learned helplessness. and also characteristics of social relations. Here I can say about traumatic experience of children, which can come from social environment. For example, from teachers, from kindergarten nurses, and so on. When children are very young, they are very sensitive to everything what they can see and can receive from the whole world. And sometimes parents even do not know about this traumatic experience. I can add about somatic health that not only the disease, the illness of a child can affect the learned helplessness state. But when children see someone in the family who is deathly ill or have a very difficult health state, it can be also the result of psychological trauma, and it can affect the learned helplessness state. So that was the last slide. And before going to the questions, which maybe you will have to me, I can say that the danger of learned helplessness state is turning it into personal characteristic. Sometimes we all feel helpless, but when it is just a state, it can pass and we can leave it in our past traumatic and not very good experience. But some people become personally helpless, so they think that they can do nothing in this life. They can be very effective. They can't be rich. They can't be professionals. They can do nothing, and they choose very weak life activity, and usually they are very frustrated and think they have very low self-esteem, and they are not hosts of their own life. And this is the difficulty which usually I try to overcome during my psychotherapeutic sessions with my clients. And sometimes all the roots of this helplessness state and personal feature goes to the childhood, to traumatic experience, and to child-parental relations. So now I can put this slide on the monitor. Thank you for your attention during my short presentation. I do not know whether you heard something about this state, which was discovered by American psychotherapist Martin Seligman. So he is the founder of New Positive Psychology, and he was the first psychologist who started talking about learned helplessness state. He has a very big school, and many scientists all over the world now pay interest and pay attention to this state because it helps to make people happier and healthier in psychological side, I think.
Yes, Professor. I think it was wonderful presentation on the topic learned helplessness. Dear Professor, can we take questions from the participant now?
So will you repeat once again? So I have difficulties in internet connection, I think.
Yeah. Shall we take questions from the participant now, Professor? Questions from the participants.
So the questions from participants, you mean?
Yes.
Yes, but I know that Indian people have very specific accent, and Russian people as well speak in English because it is not my native, it is not my mother tongue. So that is why I try to speak not very fast, not to make many mistakes, and I will have a request to you. Please speak a bit, not very fast, so for me to understand easier.
Noted, noted. Dear participant, you can ask, unmute your mic. You can ask the question to the resource person. I think you noted the instruction given by the expert. Please ask your questions now.
Hello.
Yes.
Hello.
Sir, I'm Sangeeta calling from Coimbatore.
Yes.
So thanks a lot for your arrangements, and it's a wonderful presentation also.
Thank you.
Thank you.
My question is, see, if a parent is highly supportive for a child in a family, so that child is completely secured and emotionally attached with with his or her parent. So how do we find out that emotionally weak or like this learned helplessness? Sometimes parents may be supportive also, right?
Yeah.
So if they are highly emotionally attached to a child, so when the child gets developed, so how do we find out like this child is highly emotionally okay or learned helplessness? Is there
Okay.
any difference, ma'am?
Thank you for your question. And I have had a very long study which was conducted for finding the age periods where every part of learned helplessness will demonstrate the weakened parts of personality, which can support this learned helplessness development. And when a child in the age since 3 years old till 7 years old feel insecure, you are very right, feel anxious and feel depressed, when a child cannot demonstrate his alive emotions, he is not very accepted as a child. When he or she, when a child has traumatic experience or experience of violence in the family, it is a sign that he in his future life will feel helpless.
Thank you.
It is a kind of first step of learned helplessness formation. When a child goes to school, so he is in his first or maybe fourth grade, so the motivational sphere here is very sensitive to learned helplessness formation. So first comes the emotional sphere in preschool age. In the early stages it is motivation. When a child becomes a teenager, it is a lack of willpower development, and in youth period, it is a cognitive sphere as a result. So lack of emotions, lack of motivation, lack of willpower, so it is combined in lack of cognitive sphere development.
Happy morning. Happy morning, ma'am.
Good morning.
Good morning. This is Madhvi. Ma'am, I have a question. A boy of 19 years is not having motivation and willpower because of the emotional trauma what he has undergone. It was marital discord, as well as he himself had some bullying in the school. So how can we overcome that at this point of time? Because already it is there in the past experience.
Okay. So in any non-drug psychological support and psychotherapy, we should go to the previous stage where the most violent traumatic experience was obtained. So first of all, we should recover his traumatic experience and help him to overcome the emotional difficulty. So if he didn't receive enough psychological and emotional support, like from his parents, he should receive. We should give parental support. So listen and maybe give psychological hugs and tell that we believe that this traumatic experience is very hard to carry, and only after a person will be strong enough to keep his emotional sufferings, to hold them and to become a bit happier, we can work on his motivation and willpower. Before we gave enough emotional support, our human support and personal and psychological support, we cannot think about motivation. The motivation will be blocked because this person will be frightened to be motivated to do something. If I'm frustrated, if I feel fear, I can't plan my life. My life won't be happy and resultative. So first of all, we should start with emotional support. Keep calm. Maybe I would recommend to give some art techniques. For example, ask him to draw his traumatic experience, maybe as a picture. So to use different art therapeutic methods to take this traumatic experience and to place it out of the personality. Not to hold it only inside, but to put it away from personality, and maybe to take his hand and tell, I'm here, do not worry. So it is safe now, I can support you, I will help you, do not worry. We can stop anytime you want to stop. Okay.
Good morning, Professor.
Good morning.
My question here is, when parent is very pampering to the child, so the child becomes overly dependent on the parent. So it becomes difficult for both psychologically and emotionally. So how do we overcome that?
So you are asking about punishment?
No, how do we treat learned helplessness? Like, both of them get personally affected. They develop a more dependency with each other. So they become, both the parent and the child are very dependent with each other. So at a certain point, the child becomes very emotionally affected as well as psychologically affected when he or she is let out into her own life. So how do we treat it, or how do we overcome it?
Thank you for the question. And I think that in all situations when our clients come to us and they ask for help in the sphere of parental relations with their children, we should start not with children, but we should start with parents. Sometimes parents are very anxious. They have difficulties in their emotional sphere. They can't believe that their children are strong enough to live their life. They feel fear for their kids, and that is why they cannot let them to be separated. And here we should work, first of all, not with children, but first of all with parents. And we should work with their psychological difficulties, which are usually concentrated in their emotional sphere. Probably it is their traumatic experience from their childhood, which they take from their childhood and bring it to their adult life.
Thank you, Professor. So we have to, first treat the parent so that the child and the parent works out well.
Sure, yes.
Thank you. Thank you.
And usually when we change the psychological state of parents, we should do nothing with a kid, because children feel that now they are secure, that the psychological state of their parents is stable, that their parents are very strong, can support and defend them. And in this moment, children feel safe, feel calm, and they start their development in a very natural and very usual way.
Thank you. Thank you, Professor.
You're welcome.
Ma'am, I have a question, ma'am.
Ma'am, I think we are running out.
If the parents are over pampering the child,
Mm-hmm.
the child become learn helplessness. Yes, sir.
Yeah, ma'am, we are having less than a minute, so I take this opportunity. I think you can ask your questions in that WhatsApp, ma'am. I will convey the message to her. Definitely, I will get answer for your question.
Yes, sir.
Yes, ma'am. Dear Professor.
Sorry, one second, Suresh. See, the questions can be sent in the mail we have sent, so it will be easier, because when it is there in the WhatsApp, there are 4 groups are there, then it will be very difficult to trace and send the question to Olivia. So I think it is one email ID is there, so there which we have shared, they can send the mail, we can share with the professor and get the answers.
Yes, sir.
Thank you.
Dear Professor, I take this opportunity